This is Team 22's Early Childhood Integrative Observation Assessment of Grayson Carta by Samuel Pierce, Danielle Dixon, Ethan Tran, and George Columbiers, St. Louis University, spring of 2024. Progress Report. Interview occurs in Grayson's home. As a group, we thought it would be good to interview Grayson in the setting of his choice. Grayson likes to play outside, so a majority of his personal interview takes place on the back deck of his home. For Grayson's one-on-one, he talked to Sam. There was some commentary from Sam's girlfriend, attempting to get his attention and encouraging him to answer questions that he typically could have been able to answer, but wasn't. For questions that Grayson wasn't able to answer, and more developmental questions, we asked his mom, Carrie Carta.
Okay, so a little bit of background about Grayson. He is an adopted child who lives in a semi-rural town, Poplar Bluff, Missouri, which is in southeast Missouri, about 2 hours south of St. Louis. His mother, Carrie Sarda, is a 57-year-old doctor who specializes now in regenerative health. She was an OBGYN, and so she travels a lot for her work. She travels all over the country to meet with patients. And so Grayson lacks a little bit of stability in his life because his mom is not always around. So he's a little bit behind on some of the cognitive aspects of his development. He's just learning his ABCs, for example. He knows how to spell a few words. He just learned how to spell his name. And so because Grayson's mother is gone, his care is split amongst 3 caregivers most of the time, causing inconsistency in routine. So his primary caregivers are his mom, who takes him with her whenever she's able to. His grandparents, and they take him pretty much every other time that they are able to. And if not, Carrie has also hired a nanny who takes care of Grayson whenever Carrie or her parents are not able to. Grayson also has a very large family, a very tight family that is very involved in his upbringing because of his mother's chaotic schedule. So they really help to push him, to teach him, and they're trying right now to get him on track and to get him to hit those milestones, cognitively especially, that he should have hit already, but he is a little bit behind on due to some of the instability in his upbringing. So some observations for during the interview. Very hard to hold Grayson's attention. It took way longer than it should have for the amount of information we got out of him, but he's a 5-year-old. He didn't want to sit still and talk. So, and a little insight into his gross motor skills and their development. Right before the interview, he told me to watch this, and he fell off the porch and flat on his face. So that's just a little insight into where he's at with his motor development.
Here are some of the questions that we asked Carrie Carta, Grayson's mom.
Grayson, he spoke late. He didn't really start speaking to us about 3.
When do you start speaking in full sentences?
Probably 3.5.
When do you start counting?
Probably about 4.
Okay. Where have you seen the most growth in Grayson the last year? Vocabulary.
Oh, definitely.
Not me.
Concrete thinking and maturity in this last 6 months. Definitely counting.
That's the right key.
This might be the old one. So you need to bring this
Letters.
when you come. That might be the
I would
old
say
adage,
between
is what I'm saying.
about just before he turned 5 to
Might
5
be
and
to
a half.
have. Is that to your house?
And then how well does Grayson interact with other
Your
children?
key
Oh,
is
wonderful.
right. This is
Very
right.
friendly.
Does he play with toys or engage in imaginary play?
Is she giving up the apartment?
But not yet.
Still toys.
Okay.
All right.
Still toys.
That's it.
All right, Grayson. All right, Grayson. What's your favorite things to do?
Play.
Play? What do you like playing? What do you like playing with? Candy? You like playing with candy? Okay. Do you like to play Spider-Man? You like to play with your toys? No? You don't like to play with your toys? Do you like playing with the kids in your class? At school? You don't?
Yeah, you do.
Okay, Grayson. What's the most important thing to you?
Clean your mess up.
What?
Cleaning your mess
Cleaning
up?
your mess up? That's the most important? That's a good one. What's your favorite thing? What are you learning at school, Grayson? Your ABCs at school? No. What are you learning at school?
My teacher has to make me do homework.
She makes you do homework? Yeah. What does she make you do? What is your homework?
No, I'm videoing myself.
Grayson, what does she make you do for homework?
I don't know.
You don't know. Are you
Well,
not
just-
learning your ABCs?
Think of your last homework you had.
Okay, Grayson, what's something that makes you happy?
Going to a candy shop.
Going to candy shop? You like to play too, right? Does that make you happy? Yeah? Okay. Grayson, how many words can you read? What words do you know how to read?
100.
100? Oh my gosh. Okay, can you spell no for me?
You know.
Can you spell yes for me? Can you spell another word for me? What's another word you know how to spell?
Y-E-S.
Y-E-S? What's that?
Yes.
Yes. What about go?
I can't spell that.
Can't spell go? Okay. Grayson, that's it. That's all you got?
The first developmental theory that we'll look at is Lev Vygotsky's sociocultural theory of development, which emphasizes on the role of community, social interaction, and language in how a child can learn. Vygotsky's theory focuses on the zone of proximal development and scaffolding, where the zone of proximal development is what a child is able to learn with the assistance of a teacher or caregiver, and scaffolding is how a teacher or caregiver provides support to the child to help them learn beyond their current capabilities. Moving on to the interview with Grayson's mother, we asked about Grayson's development, such as questions about when he was able to speak in sentences and when he was able to count. And she answered that Grayson was able to start speaking when he was about 3.5 years old, and that he was able to count when he was 4. She also mentioned that Grayson is behind the other children in his kindergarten classes in terms of having trouble focusing, spelling, and reading at his classes level. Looking at the interview with Grayson, we can see that Grayson does have difficulties in focusing on questions that Sam asked and remembering about what he's learning in school or at home. And as mentioned earlier, Grayson is having trouble reaching the milestones that a normal 5-year-old should have by now. This could be a result of inconsistencies in scaffolding for Grayson, as his home care is split between 3 different caregivers, that being his mom, grandparents, and nanny. By having 3 different caregivers who all might have different teaching styles, they might approach teaching Grayson in various ways, which in turn might confuse or leave gaps in learning for Grayson. For example, his grandparents might be teaching Grayson something that might not align with what his mother or his nanny might be teaching him, which could cause Grayson to become confused about what he's learning. Another point I might add is that in Vygotsky's theory, he also emphasizes the importance of having a secure attachment between the child and the caregiver. Bringing this into Grayson's situation, he might find it difficult to form secure attachments between each of his caregivers due to the frequent changes. This could come with Grayson not being willing to engage in meaningful learning experiences because of the inconsistent changes of who cares and teaches him.
The second developmental theory that we'll be looking at is Jean Paget's stages of cognitive development. There are 4 stages in this theory. The first one is sensory motor, from birth to 2 years old. The second one, pre-operational, which is 2 to 7 years old. Concrete operational, which is 7 to 11 years old. And formal operational. At this point, Grayson is in pre-operational, meaning he is learning the world and explaining how he sees things in the world, putting a word or a thought into something he sees, being able to express what he sees. Questions that were based on this theory that we asked was what type of toys he likes playing with. He's able to verbalize which toys he likes and which toys he doesn't like. And also, what do you like to do when you're playing? He's able to also vocalize what he likes and what he dislikes, which is like the whole thing for all of the questions we asked. One area of development that Grayson right now is working on is memory. Memory is created from birth to 8, and worked on from birth to 8. There are 3 types of memory. There is short-term, sensory, and long-term. Sensory can also be considered working memory. Short-term memory is being able to go back 5 or 10 seconds and recall something. And you could have up to 7 items that you're thinking of and recalling back to that. Long-term memory is something where you can reach far into the past, thinking about what you did in the last week, the last month, and how you reacted to that. Sensory or working memory is memories that you have learned to do. So that would be going back to something and you're being like, I am not going to do this one thing because it hurt me, or I am using the knowledge that I previously have to protect myself.
Another theorist I want to talk about is Chomsky and his theory of language acquisition. One component of Chomsky's theory is the critical period of development. Chomsky, along with other linguists, posited a critical period for language acquisition during which the brain is particularly receptive to linguistic input, making language learning more efficient. One developmental area that we found Grayson struggling in was language and thought. Typical 5-year-olds are able to compile sentences with few words. Grayson's speech, on the other hand, seems to be below his average level. He's also lacking in concentration, especially when being asked a question. Oftentimes, Grayson would answer questions, shaking his head or nodding, not giving full sentence answers. He would give yes or no answers, wouldn't elaborate on his ideas.
In conclusion, Grayson is slightly behind in development, possibly due to care being split amongst 3 primary caregivers. Grayson is developing with the help of his caregivers, according to Vygotsky's scaffolding theory. However, the inconsistency in this scaffolding could be holding him back. Grayson is in the pre-operational phase of development, according to Piaget's theory, and is able to identify and vocalize what he likes and dislikes, and is very interactive in the world around him. Grayson is not developing at a typical rate verbally. Chomsky would explain that children automatically get a feel for sentence structure and a grasp of sentence structure from hearing others around them speak, but Grayson may be a little bit behind due to the multiple different teaching styles he is exposed to. Grayson has made significant strides in his vocabulary and speaking in sentences in the last year, and continues to improve to try and catch back up developmentally.